Hi, this is Keri Claybourn again with High Point Therapy through Progressive Health. I'm at the Women's Hospital. Joining us for part 3 of our talk on cancer rehab. Today I'm going to address kind of lymphedema as well as some side effects of post-surgical surgeries that we see and can help reduce complaints of. So, common thing, what is lymphedema? So, it's a very common and serious condition. It affects at least 3 million Americans. It occurs if the lymphatic system becomes insufficient and is unable to perform its normal duties. The result of this is an abnormal accumulation of water and proteins, typically in the subcutaneous tissue. So I often tell patients, lymphedema, the difference between this is if you went and sprained your ankle, that's just going to be water and not swelling. This has proteins in it, and our body cannot absorb those proteins on our own without our help. So it is most commonly present in the arms and legs, but also can affect your trunk, your abdomen, your breast, your head and neck, external genitalia, as well as your inner organs. Usually the onset is gradual, and other times it can be immediately. So most people develop it after surgery and or radiation. So we think of our cancer patients with that. But it can also develop as a secondary lymphedema for no reason or a primary lymphedema. So it's serious because of its long-term physical and psychological consequences, and it continues to progress if it is left untreated. What are some signs and symptoms of lymphedema? Often I'll ask patients, are you having any pain? And like, well, I don't have pain. But then as I go on to explain, is it a fullness, a heaviness in that arm or that leg or chest or abdomen? They'll describe it as feeling like the skin's very tight, like it's going to kind of bust or rip apart. They may notice some reduced mobility or flexibility in that area. If we're looking at areas that commonly with jewelry, your rings may fit, your watch is tight, a bracelet. A lot of times with the upper extremity, patients will complain of feeling like there's a wad of something underneath their arm, or they'll notice that they go to put a shirt on and it's a lot tighter on one arm or leg versus the other. The swelling can fluctuate too, and that often will be uncomfortable for patients. So here's some examples and some pictures of lymphedema. So it kind of shows the pre-stages, stage 1, 2, and 3. So you can see all the different changes that can occur, the lobules, the hard fibrotic areas, the changes in the skin, the coloring, shininess. So in 2018, more than 3.5 million people with a history of breast cancer will be living in the US. And even 5 years post-surgery, approximately 68% will report upper body pain, 72% having tightness in the area of the surgery, 67% having limited shoulder range of motion, and 20% will develop lymphedema. So complete decongestive therapy is the therapy of choice for most patients suffering from this. So this is a multi-approach. The goal of it is to reduce the swelling and improve function, reduce risk of infection, and really improve the lymphatic pathways. So complete decongestive therapy is comprised of 4 parts. Number 1 is compression. Number 2 is manual lymphatic drainage. 3 is skincare, and 4 is exercise. Below is kind of the picture of the lymphatic system where you can see that we're broken into 4 quadrants. So you can see that the area from the left quadrant that kind of breaks through here through our sternum into our ribs, all of this will drain over here. All of this will drain over here. The lower will drain into the inguinal lymph nodes, and then the same on the other side. So when we're talking about having lymph nodes that have either been removed due to cancer and or radiated, you can see those pathways are blocked. We call that area not healthy anymore. So we're wanting to move to healthy areas. So the first component of that complete decongestive therapy is compression. With this, we use short stretch bandages. Oftentimes, patients will think these are ACE wraps. They are not. They have a different type of stretch to them. Or another device, which could be a Cercade reduction kit, Jobs, Pharaoh wrap, anything like that that can help to reduce your swelling and help to absorb those proteins. The goal of this is to get that leg, that arm, that extremity as small as possible and reduced, and then fit the patient with a compression garment to wear for that long-term management. So typically when we are seeing someone and wrapping them, we are seeing them every day for the first week and then reducing down to 3 times a week. The reason why is we need to make sure the patient is safe when we are doing this, that they are tolerating the movement of this fluid, that their heart is doing okay with it, their kidneys are doing okay, that things aren't rolling and slowing down. So safety is our number one key. If patients are coming from out of town and cannot commit to that, then we have lots of different options. So on that first visit, we're always looking at what's the best option for that patient for efficiency, for visits, for time, and for all of that. The second one is manual lymphatic drainage. So with this, we're using a light touch where we have a skin to skin using a skin stretch to help move to the healthy lymph nodes. So for example, this picture of this lady here would be a right breast cancer with lymph nodes or radiation, where the left side is still intact, the cervical area is still intact, and the inguinal lymph nodes are still intact. So we're looking at moving the fluid using this very light touch, which is a superficial system, to help reduce that. So the lymphatic system does not have a pump when we're talking about the arteries and the veins. They have the heart. With this, we don't have a pump. We either create that pump, so we teach family members how to do it. We can teach the family, the actual patient themselves, or there is a pneumatic pump that is on the market that sometimes can help, that the patient can use daily, that's designed to help treat lymphedema. Usually compliance is better for the patients and family members with this pump because they can put it on themselves, they can press a button, they can watch TV and read a book as they're doing it, and that makes things better for long-term management. Skincare is key. You want to make sure you're keeping your skin clean. You want to make sure you're inspecting for any cracks, fungal infections, rashes, moisturizing daily, especially after taking your shower or bath. We want to make sure that you're using lotions that are preferably free of alcohol and fragrance. We typically recommend Eucerin cream or Aquaphor. They have a low pH, which works really well on the skin. You want to make sure you're drying your skin thoroughly, using a soft towel and not scrubbing. And if you're undergoing radiation, you want to make sure that you're applying the ointments and what is recommended by your physician to any radiation redness on your skin. The importance of the skincare is helping to reduce infection. And then exercise is the most important key at the end. So if we have the compression in place, we're moving the fluid over to the healthy lymph nodes, we've got proper skin care. Exercise is important because with the compression on, it activates the muscle pup action to help reduce swelling in the area affected. Too much exercise can have a negative effect and increase swelling. So you want to be cautious with that and listen to your body. You want to wear compression with it. If you wish to do high intensity, you may need to take extra precautions and add extra compression during that activity. And then ideally, these exercises are performed 10 to 15 minutes following the manual lymphatic drainage, and the patient should rest with the limb elevated for 10 to 15 minutes post-exercise. Stretching, yoga, swimming, water, and walking are beneficial additions to help with this decongestive process. A lot of people will ask about nutrition with lymphedema. It's definitely something that needs to continue to be researched. As with anything, obesity can have a negative effect on your swelling. So you want to maintain an ideal body weight. There's no special diet. You want to aim for fruits and vegetables, low salt, low fat diets, eating too little protein, and to see if that will be beneficial so your body doesn't have those proteins is not recommended and may cause serious health problems. And then research does not support supplements in helping to reduce lymphedema at this time. So in kind of conclusion here, anyone who has undergone lymph node removal or radiation is at risk of developing lymphedema. This can occur anytime in your life. It could be immediately, it could be 30 years later, so you're always at risk. Certain activities and situations may trigger the onset of it. You need to be aware of those risk factors. For example, you want to make sure if it's your right side that was affected, that you're not having blood pressures done on that, you're not having blood draws, you're being more cautious of bug bites, sunburns, anything like that. I think the biggest thing too is patients will say, "Oh, I can't do that anymore." I mean, we want to encourage a normal activity level, and individuals should not go to the extreme and refrain from using the arms or the legs in fear of developing lymphedema. So here are some precautions. I'll let you kind of read through those. I already mentioned a little bit of them earlier. Um, Talks also about, being aware of tight-fitting clothing and jewelry. So I also mentioned in conjunction with lymphedema, some of the things that we'll do is work on reducing pain following surgery. So common problems seen post-surgery for mastectomies, lumpectomies. This is for the arm, so this is a little bit more catered towards our breast cancer patients. You'll see the posture impairments, the neuropathy, some tendonitis of the rotator cuff. Sometimes you'll see a frozen shoulder because patients aren't moving. You can see some lateral epicondylitis, most commonly known as tennis elbow, some post-mastectomy syndrome, and then swelling. So there are some consistent findings that majority of women experience one or more limitations with the following. Um, if they've had an axillary lymph node dissection, if they've had removal of greater than 15 lymph nodes, a mastectomy, a radiation, if they're at least stage 2, if they had positive lymph nodes, they're older age, and a BMI of greater than 25, they have a greater risk after 12 months post-surgery of having more complications. And then ages 65 or plus seem to have the most persistent problems. So some of the things that we'll see is the shoulder blade, which is also known as the scapula, it just doesn't want to move correctly because of the decreased muscle activity in those muscles and the increased tightness in the chest. You may find patients are more in that forward shouldered position. And so because of that, they're not able to raise their arm up as much. They're not able to engage those muscles back there for that correct posture. So we can help them with that. There's a post-mastectomy pain syndrome, often described as pain consisting of burning, shooting, kind of a deep pain. Can be in the armpit, the shoulder, the chest wall. It's usually prevalent more after lumpectomy versus mastectomy. And the risk factors for developing this include breast surgery early, tumor in the upper lateral quadrant here, and a younger age. It's also more common in patients that have had radiation higher up in the supraclavicular area, as well as the axillary region. Cording. So this is the axillary web syndrome. This is the result of the axillary lymph node dissection. What we do with this is patients will often complain of, they go to move their arm up and they feel this pulling that comes down here. It can come along the inside of the elbow. It can come down into their wrist. And it's very, very uncomfortable. Like they go to reach up and you just feel it down here. I like to describe it as like guitar strings. So my best way of looking at it, and I know this is not what happens, but when they go in and they remove the lymph nodes, it reminds me of like pulling weeds. So you think everything's kind of pulled and everything's disrupted in that fascia of that area, which is why people will develop that numbness and tingling here that typically does go away with time. So if we see this cording, we can get these cords to release by applying a pressure. The best way of describing the release is like a seam. If you think of a seam on a shirt or pants or something and it kind of lets go, that's what happens. And the patients will have immediate relief from all of that tension that is pulling. So as previously mentioned in other things, there's lots of studies that show exercise and the psychological interventions are effective in reducing these cancer treatments, as well as the lymphedema, as well as the mental aspect that places. There's still limited research on immunotherapy and the role of PT in that. Um, the big thing, and kind of going back to how can we help, is we want to improve your quality of life. The most common things that our patients will come and say is, I just assumed I had to deal with this. I just assumed that this was something I was going to have to live with the rest of my life. And there is long-term management that's involved. There is that, but you don't need to be in pain. You don't need to be worried. Like for my breast cancer patients, like I haven't been able to lay on that side for a year because it's so tender. I can't hug someone because it's so tender. I can't wear a bra because I have so much pain. That's not normal. So please come see us. Please talk to your doctors. Please know that this isn't something you need to live with. For any of our pelvic patients, because we are seeing a lot more of the female cancers happening. So the swelling in the genital area, as well as the legs, the pain in the abdominal area, the fullness in the abdomen area, the effects on clothing, the effects on just your personal hygiene. There are things that we can do to make this better. On our head and neck patients, that's definitely an underserved population. You know, they're not realizing that any external swelling they're having is affecting them internally. So they're not able to eat and drink. They're on a peg tube. They just want to get back to drinking something, eating something, and living a normal life again. Therapy can help, because if we can reduce those external changes, you can get those internal changes. And in combination with speech therapy, we can make that better so that you're not sitting here unable to eat or drink for years or thinking this is what your life has to be from here. So, you know, I think, like I said, as being a cancer survivor myself, um, I just, my goal, as well as our team's goal, is just to help you all in that journey, whatever it could be, whether it's the psychological aspect, the physical aspect. We have an awesome team, lots of resources to be able to help you in what you need. So this is just a snippet of what we can do, a very short snippet, but surely if you have any questions, feel free to reach out to Melanie. She knows how to get in touch with me. And like I said, my name is Keri Claybourn, and I am at High Point Therapy at the Women's Hospital. And thank you very much for having me.